Hey everyone, I think we're live. Are we live? Welcome. I think we are. Can you hear me?
I can hear you.
Yay! You never know how this is going to go. Welcome everybody. It is Wednesday. I think we're in the month of May of 2019, and it is the Dr. Sue live Q&A, and this month we are talking all about bone cancer in dogs, and I am so excited that I am joined this month by Dr. Caitlin DeWild, who is a fabulous veterinarian in the St. Louis area and also helps me with all my social media. And this is the second month, right?
Yeah.
Yeah, second month that we are co-hosting these Q&As, and two reasons that I love it. One is I think it helps me help the audience answer their questions because she can be looking at the questions while I'm answering them. And it's also just fun to have another veterinarian here to give their 2 cents. And, you know, you're out in the field, you're in practice as well. So, and you often have a different perspective because you're a general practitioner, you're in the trenches, you're often diagnosing these cases, right?
Sure. And then texting you, like, now what do I do with this?
Right. But I think, you know, I say all the time, I think the general practitioner has a much harder job in a lot of ways than the cancer specialist. No, you do, right? You're the one who has a dog come in, limping, lame. You know which dogs are at high risk for osteosarcoma, and you're the one who's taking the x-rays and you see that suspicious lesion, and you're the one who has to walk in the room and break the bad news. So I often, you know, hats off to the general practitioner because you guys have such a hard job. And then, you know, you're often referring the case to a cancer specialist like me, and we have to work together.
Yep, absolutely.
All right. So we have a few people hopping on, which is great. Thank you guys so much for joining. So if you're here, let's see if the comments are working today. I would love to know where everybody is from and make sure that I can see the comments and the questions. So why don't you say where you're from, and hopefully then we're going to jump in pretty quickly tonight. We're going to do a little bit of a slightly different format than we have in the past, and I'll explain that in a few minutes. But oh, there we go. Great. We have Ashley. Yep. Yep, GPs of just have so much respect. Absolutely. That's Ashley. She is a dermatologist out in the Portland area. And you met her.
I did.
Yeah, she has a 2-month-old baby. And we have Trustin, who is
another
vet student who is just going into 4th year, right? Trustin going into 4th year, I think. So thank you guys so much for joining. Ashley is from Portland. Trustin is from California, and he's always sharing beautiful Instagram. Guys, if you're looking for an awesome couple of great other social media sites to follow, I'm going to do a shout out for all the people that are on here. Check out the Social DVM, which is Caitlin DeWild, who's, I always get the cameras are always mixed up. You're that way.
You're above
me that way, but you're that way. The Derm Vet, which is Ashley, for just whole great social media site, and then Dr. Moore, vet student, so for Trustin. So some really other great veterinary social media sites to watch. We have Joni, who's here from Kansas. Yep, Trustin is officially a 4th year vet student at Western U in beautiful California. So very jealous because so when I went to vet school at Cornell, they say there is 60 days of sun. And I'm pretty sure it's like the complete opposite out in California. So it was really hard to study on those few beautiful days, which were usually right at the end of the year when, you know, you're studying for finals. So, you know, when you're in California, every day is beautiful. So we have someone here from Ohio. So Patty's here from Ohio, which is where my in-law family is from. So thank you guys so much for joining. Looks like the comments are working, which is really, really exciting. So normally in the other Q&As, I would do a little overview of the cancer that we're doing. So what I've decided to do and what I've been doing recently is moving those videos to separate videos on YouTube, so they're easier to find rather than looking for the Q&As. And we've also sort of reformatted everything on YouTube. So this is going to be my little reminder to tell everybody to hop on over to YouTube and look for the osteosarcoma playlist. And that's where I have all our videos about osteosarcoma. If I have a patient that I treated, for bone cancer, it'll be in that playlist. A previous, Q&A on osteosarcoma is going to be there. Last couple weeks ago, I did a vlog all about amputation because I know how hard it is to make that decision, and I'm sure some questions will come up, but that is one of probably the toughest parts of the decision-making process for dogs with osteosarcoma, is to amputate or not. And the good news is most owners are really, really happy with their decision. So again, I wanted to do a whole separate video about amputation. And then at the end of this week, I'll have part 1 of a brand new informational video all about osteosarcoma. So just an overview. And then next week, we'll have a summary video of different treatment options: amputation, chemotherapy, radiation, and then pain medications, what we call palliative. So even though we're going to answer questions, hey, Jenny, thank you so much for joining. I want you to be able to find those videos, and please subscribe to those videos. And if you have a friend, share the videos, comment on the videos. And I'm doing that for all the different Q&As that we'll do each month. I'm trying to separate out the informational videos so you can find them, and hopefully play them back. And as I say, if it's too much information, pause, get a cup of tea. I have my tea here tonight. Get a beer. I know Caitlin prefers beer. I prefer wine. Whatever your beverage is of choice, and you can just watch those videos as much as you need to, and just in the time frame that you want. I know I'm a New Yorker and I talk fast. So again, with these videos, you can stop them, slow them down, and watch them at your own, leisure in a speed that works for you guys. So Angel, thanks so much for joining. And again, please subscribe if you haven't yet subscribed. That's a great way to know when the new videos come out. So again, osteosarcoma part 1 will be coming out probably Thursday, and part 2, summarizing the treatment options, will probably be next Thursday or next Friday. And then this replay will end up on YouTube in a couple of days as well. All right.
Put the links to subscribe and to the osteosarcoma list in your comments.
Awesome. All right, so that is there. So there's my little reminder to please subscribe on YouTube. And then, like I said, I want to spend the rest of this time answering everybody's questions, because that is really why we're here. So Caitlin, I know we've had some questions come in on some of our other resources, but you tell me, where do we want to start?
I think a good one is the one that I just lost because I was scrolling and putting the comment link.
What's in your cup tonight?
I promise, just water. I just actually got home from work about 25 minutes ago, so I am rehydrating. But don't worry, I will probably change.
And I want to thank you for doing this after Caitlin and I both work today, so
a little rough. This is
a little bit rough.
Okay. Okay, I found it. So this is a great question from Sue Costello, and she said, I've heard that using Losartan has helped in slowing down the metastasis in the lungs. Have you used this drug in osteosarcoma dogs?
Okay.
I have no idea about
it. Wrong way. Oh, we're still figuring this out. Sorry about that. So Losartan is a blood pressure medication, and that's a very interesting question. So there's a study, I want to say it's at Animal Medical Center, which is where I did my internship and residency, looking at Losartan for hemangiosarcoma, which is that malignant cancer of blood vessels, which the most common place is the spleen. And so I saw this question as well. I think it came through today. I haven't yet heard about it being effective or studied in dogs with bone cancer, only hemangiosarcoma. So I haven't heard about that yet for bone cancer dogs. So, and just as a side note, I'm not using it yet for dogs with splenic cancer, hemangiosarcoma either, but excited that there are new studies, because hemangiosarcoma is one of those really, really tough cancers. So not yet a treatment that I know of effective or being studied for bone cancer.
Okay, good one. Okay, so next up is one from Anne, and Anne, I'm just really sad to even read this comment, but I think Sue will have some really good information for you. So Anne says she's trying to decide now on amputation for her golden retriever puppy, 15 months, who was just diagnosed with osteosarcoma with metastasis. Would love to get your opinion. This has all happened so fast, which is unfortunately usually what happens, and that doesn't make it any easier for anybody.
Yeah, so, cancer sucks, just to begin with. And then something about cancer in younger animals just seems a little bit more bitter, definitely for sure. And so osteosarcoma, is a cancer of middle-aged and older dogs, but it tends to be of large and giant breed dogs. So it tends to be a cancer that we see in 7 to 9-year-old dogs. If it was a cancer that we were seeing in Chihuahuas and pugs, middle-aged and older would be 10 to 12. But again, so we're seeing it in 7 to 9-year-old dogs. But there's a second peak incidence in dogs of about 18 months of age. And so this golden of about 15 months, but yeah, like I still call Penelope, who's 2 years of age, a puppy like that. And I'm sure her golden is acting very puppy-like. So that is, just, it's devastating. So, I know that's really, really hard. So in general, before you take your dog to amputation, before we decide to remove the leg. And so, when I talk about osteosarcoma, I always say there's two battlefronts. So there's the tumor growing in the bone battlefront, what I call the local battlefront. And then there's the preventing the cancer from spreading, with the lungs being the most common place that the cancer spreads. And the second most common place is other bone is the place that it spreads. And so we usually, not usually, but we strongly want to do at least chest x-rays, sometimes a CT scan of the lungs, to make sure the cancer hasn't spread before we do amputation, because the prognosis is significantly worse, unfortunately, Anne, if we find detectable spread in the lungs at the time of diagnosis. And typically, we wouldn't recommend doing amputation. We would go to palliative approaches, so keeping the dog comfortable. And so I don't typically recommend doing an amputation for a dog that already has spread to the lungs. I'm assuming metastasis is to the lungs. There will always be exceptions to the rule. And the reason I took a really deep pause is somebody, all month long on Facebook, each week, each day almost, we have a different infographic that Caitlin has helped me make really pretty graphics. And then I write the text all about the different information. And Caitlin, I don't know if you saw, but we posted the one with the dog with spread, and it looks like there's almost like snowballs throughout the dog's lungs. And someone said that they chose to do amputation and they didn't follow up with chemo. And the dog, I can't remember how long the dog was out, but the dog was out like what I would consider a crazy amount of time. I want to say like 9 or 10, 11 months out, like really, really long time. I think that's an exception to the rule. But in general, so Anne's saying chest x-rays were done yesterday and there were nodules in the lungs. In general, I have a hard time recommending doing an amputation in a dog with nodules to the lungs. So what would I do? I would consider palliative radiation, so that comfort type of radiation. So, Anne, if you're in an area, I forgot we can show the comments. So Anne says chest x-rays were done yesterday. There were nodules in the lungs. So if you can get to a facility where there is radiation, they can direct radiation to the area of the bone, and that's been shown to be very effective. It's usually weekly for 4 weeks or 2 back-to-back treatments. That's been shown to be really effective for controlling the pain in the bone. And then maybe doing some type of oral chemotherapy, some injectable pain medication called Bisphosphonates. But I probably would keep the leg on and then shift my therapy towards radiation, some type of chemo, and pain medications. But I don't typically recommend doing an amputation if there's already been spread. So it's tough. It's really, really tough. And pain medications are definitely going to be an important part.
Yeah, absolutely. Absolutely. Well, let's see if we can find something not so sad.
And she just said Auburn is not too far. So there's a great resource. So, if you're, close to a veterinary specialty hospital, that's going to be great. So often that's going to be a university. You can go to, there's 2 great websites where you can try to find a specialist, vetspecialist.com. That usually ends up in every Q&A that we do. And then the other one is vetcancersociety.org. And both of those have places on their website where you can find a specialist near you. But, usually a veterinary teaching university is going to be a great place because most of them will have radiation. I'm in the Metro New York area, so there's a good number of places that offer radiation. So that is going to be a really good option as well. So, and I'm really, really sorry. It sucks. It just absolutely sucks. So while you're doing that, Caitlin, I forgot to tell Instagram that we were on. So I'm going to do that while you're looking for my next question.
Okay.
Too many things. Okay.
Too many things. I did put the link for the vetspecialist.com and the Vet Cancer Society in the comments.
Okay.
Vet Specialist for sure.
Hopping on. Hey guys. So just hopping on Instagram to tell you that we are on Facebook Live right now and we're doing our live Q&A on osteosarcoma. So be sure to hop on there. I'm going to keep this on for a few more minutes. We have a lot of people on. We're answering hopefully some good questions, and you'll be able to catch the replay on YouTube as well. So please come on over, and hope you'll join us there. Did I do a good job, Caitlin?
It was pretty good. Pretty good.
I'm on with the social DVM, so she approves. I'm doing okay. All right, tell me what's next.
So it's kind of a general comment, but more about the lines of talking about the research into neutering and osteosarcoma at the general practice level.
Yeah.
Thoughts, comments, go.
Was that the question about why hasn't it gotten?
Yeah, I was kind of filtering it a little bit because I think it's a little dependent on your general practitioner and all of the other things that a general practitioner has to take into account.
Yeah.
So
it's a great question. So, and this comes up all the time, and this is another YouTube video that I just did, like what is the right age to spay and neuter my dog? And this is still relatively new information because, and I'm older than you, Dr. DeWild, but when I went to vet school, the standard was really to spay and neuter dogs, and we're going to focus on dogs, and it was cats as well early, and the idea was, especially, for female dogs, that early spay was protective for mammary cancer. And that has just been, there were some studies in the early 60s and 70s that showed that, early spay was protective against mammary cancer because some breast cancer is driven by estrogen and progesterone, which are the female sex hormones. So if you remove those hormones, you can decrease that risk. Over last, I would say 10 years, there have been other studies, not just in bone cancer, but seem to show an association that these sex hormones, the female ones, estrogen and progesterone and testosterone, may have a protective benefit for some cancers. And one of the first ones I want to say was around 2010, and it was in Rottweilers. And they looked at Rottweilers that, and often we'll use neuter for male and female, but dogs that were neutered young were 4 times more likely to develop osteosarcoma in Rottweilers. A lot of the studies are often in certain breeds. So Davis, University of California, Davis did a study looking at over 600 Goldens with some orthopedic issues like arthritis and cruciates, mast cell tumors, lymphoma, and I think hemangio. And again, dogs that were delayed their spay and neuter had less of these cancers. So again, it seems like there's a protective benefit for some of these cancers. So what is the right age to spay or neuter? And it's a really complicated question. And that was kind of why I did this video. So I'll tell you what I did with my own dog. So Matilda, who's now 10, she was spayed when she was 6 months of age, because this is right before I was learning this information. Penelope just turned 2, and I chose to delay her spay till she went through a couple of heats. So because I want to decrease her chance of osteo and lymphoma and hemangio and some of these other potential cancers. She still could get cancer, for sure. She still could get these cancers. And she's at increased risk potentially for mammary cancer, though some studies say it's maybe not as bad as we thought it was. But mammary cancer, breast cancer, is external. Dogs have 10 mammary glands. And part of my monthly see something, do something, why wait, aspirate, when I'm feeling her for lumps and bumps and skin tumors, I include the mammary chain. And I can feel those tumors, and I can find them when they're the size of a pea, and I will do an aspirate. And 50% of dog mammary tumors are benign and 50% are malignant, and half of the malignant ones are cured with surgery. So that means 75% of dogs with breast cancer are cured with surgery alone. And that is a lot better statistics than osteosarcoma, hemangiosarcoma, and a lot of the other cancers. So for me as a cancer doc, I decided that it was worth the risk to delay her spay for these other cancers. So again, for me, people say, well, if you have a dog for high risk of osteosarcoma, so which your dogs are high risk? There are certain breeds. We think of, what breeds do we think of? Rotties, Great Danes, Irish Wolfhounds, Greyhounds, Goldens, unfortunately, but they, St. Bernards. But a lot of studies say it's really not the breed, but it's the size of the dog. So it's and sometimes it's the height of the dog. So large and giant breed dogs. So if you have a large and giant breed dog and you're a responsible pet owner, I would probably delay their spay and neuter and start feeling their mammary glands once a month. That's personally what I would recommend. Shelters, there's a huge problem with pet overpopulation. We're getting a little off track here, but it's really important that we control the pet overpopulation. So again, I still think it's reasonable. Would I tell you not to adopt a pet that's been, spay or neutered early? Absolutely not. But again, because there are going to be dogs that are still intact that get cancer. I always use the analogy. It's like people who've never smoked a cigarette and they get lung cancer. And then there are people who smoke 6 packs a day and don't get lung cancer. So nothing's going to guarantee. But again, that's what my recommendations are. But it does look like for bone cancer, there's a protective benefit of leaving dogs intact longer. We just don't know how long that age is. So is it 2? Is it 3? Is it lifelong? I would like to see most high-risk dogs get to at least 2 or 3 years of age. And I think the recommendations are going to change. They may change in 2 years. They may change, it's a work in progress. And so that's why, we're going to have more information as these go by. Why is this information slow to get out? It's a great question. But the cool thing is I do think, Caitlin and I go to a ton of conferences because we speak and we travel all the time. And I am seeing more information at conferences about this. There's a lot more lectures about it. There's a lot more articles coming out in the veterinary journals, Clinician's Brief, Today's Veterinary Practice. So I think this information is getting out there. And again, that's why I'm doing videos about it. And sometimes, guys, it takes the proactive pet owner to bring this information to their veterinarian and say, let's not spay yet, So, I think we have to all be educated pet owners ourselves.
Sure. Yeah.
That was a long-winded answer.
It was.
Sorry. I feel really passionate about this one. And then I felt really guilty about Matilda, right? Like, did I do something bad? Like, was I a bad pet owner? And that's not what we want. So it's complicated.
It is. And I think from the general practitioner perspective, it's more of looking at that data, looking at that specific dog, looking at that specific lifestyle and putting that all together. And that's why it's so good to have a relationship with your veterinarian, and hopefully your veterinarian goes to all of Dr. Sue's lectures, so you'll be fine.
Well, and to be honest, that's why I put it's often a hard thing as a veterinarian to have that conversation. And that's why I'm trying to make good information. So it's for the pet owner to have time to, listen to it, and for other veterinarians to say, you want more information,
Sure.
Because there's some good information on the internet and there's some not great information. And that's I think that's the hard part as a pet owner, right? Is not always the prettiest websites are not always the best websites.
That is true. That is true.
That is true.
Okay, so we've got some other good questions, including one from Angel, who is a top fan. She has the badge and everything on her name, which is super cool. So thank you, Angel. So she's got kind of a two-part question. So let's dive into that one. So can you discuss the order of diagnostics to be performed when a lump on the lower front leg is observed? Let's say it's the size of a shelled egg. Start there.
I was trying to get that. I was trying to put the question up. Oh, I got to sit up tall with these big questions when they're on the screen. Okay, can you discuss the order of diagnostics performed when the lump on the front leg is observed, say the size of a shelled egg? So, and I assume we're still talking about bone cancer here, though, right? Like we're focused. Yeah. Well, I easily get distracted with other bumps. I'm like, oh, are we talking about bumps? Concerns about track seating. Okay, so in general, most of the time, you have the history. So which is a dog that is usually recently lame over the last days to weeks, right? So they're limping, they're lame, they're sore. You have the right age, so usually middle-aged and older. It could be that dog that's about 1.5 to 2 years of age, like Anne's dog. So you have your classic, in vet speak, we call it the signalman. So you have your middle-aged and older, large and giant breed dog. You have the history that they're, limping, they're lame, they're sore. And then it's typically the classic location. So we have a great graphic for this, Caitlin, on Facebook. So the classic locations are towards the knee. So the bone, right above the knee, right below the knee and at the ankle, and then away from the elbow. So at the wrist and at the shoulder. So when I have all those pieces together, I'm already suspicious of osteosarcoma. And then we take x-rays and there's some classic changes that we see. So, and usually there's a lot of bone destruction and sometimes bone production on there. In most parts of the country, it's osteosarcoma till proven otherwise, because 85% of dogs that have primary bone cancer, it's osteo. If you have a little pug or, and small dogs get bone cancer too. I've been posting the last couple of months about Poppy, who's a little terrier breed that I'm treating, that has osteo, and I treated a little pug, and that they can get bone cancer as well. But, typically, in many cases, I usually, for skin masses, I recommend aspirates and biopsies. But most of these high-risk cases, based on all the things that we talked about, we're going to go straight to amputation and confirm our biopsy. The ones that I'm really going to want to do aspirates and biopsies first are when something isn't right about the case. The x-rays don't look right. It's a small breed dog. The lesion is not in the right place on the body. It's in the wrong part of the bone when we look, like it's in the middle of the bone, not the end of the bone. Those are the ones I might say, you know what? We're not taking the leg off without doing an aspirate or a biopsy. So, Angel, we don't always do aspirates and biopsies. And that's where the internet will never replace going to see a specialist and having the one-on-one conversation. But many of these cases, we're just going to go straight to amputation. If we wanted to get some cells from it, we will often do a bone aspirate. They're sedated. They get pain medication for that. But I don't typically do a biopsy because they're more at risk for fracture than biopsy. And aspirates are usually diagnostic. And they can do something called alk phos staining on that, which has been shown to be very confirmatory for osteosarcoma. So we don't usually need to do bone biopsies in most cases. But again, there are going to be some exceptions to the rule. You can see these, but if you're going to amputate, you're not going to be worried. Say you were going to do radiation or like a limb spare. Yeah, you need to plan your aspirate or your biopsy very carefully so you're not going to drag the cells. So again, that's going to be one you're like, so what is a limb spare? I have a dog that I just saw the other day, Belle. Her tumor's right by the wrist. It's one of the few locations where we can remove that segment of bone and put a really cool long bone plate in. So she's not going to get amputated. And I happen to be at a place where our surgeon is specially trained to do that. It's really cool. So if we were going to do an aspirate, I need not to contaminate the skin because that skin and that leg is staying there. So there would be concerns about it. But if you're going to amputate, it doesn't matter because the leg's going to come off anyway. So And before you go to amputation, you always want to do blood and urine and 3-view chest x-rays. I mean, those are sort of the order of the tests that I will do. Ultrasound, I don't always do in every dog with osteosarcoma. And again, this will be reviewed in the video that's coming out at the end of the week. It's never wrong to do an ultrasound in a middle-aged and older dog before you remove a leg. Caitlin's shaking her head yes, especially if you have a high-risk cancer breed, a golden. Why? You just want to make sure that you know that they're healthy before you embark on this really big experience, right? Mm-hmm. I once had a cat that came in for an oral tumor. They don't usually spread to the abdomen. We found bladder cancer at the same time. The owner still treated the oral tumor, but they were really happy that they knew everything that was going on. No surprises 3 months later that the cat had bladder cancer. So I think it's reasonable to do an ultrasound, but if an owner's like, you know what, I need to pick the most important test, chest x-rays are more important than ultrasound for a dog with bone cancer.
Absolutely. Yeah. Okay, cool. I think that answered most of her first question. She had another question a little earlier.
Okay.
That was about the use of biophosphates for those that don't amputate.
Bisphosphonates. Oops.
See? I don't know what this stuff is.
Yeah, you do. So bisphosphonates, it's a really crazy long word. See, I'm still on Insta. Okay, guys on Insta, hop on over to YouTube. I'm like, just letting it run. Thanks for joining. Okay. And someone is asking me about a pregnant cow. I don't do cows, but thanks for watching. That's for Caitlin. Get on social DVM. She loves cows.
Well, thanks. Thanks.
That's for you, honey.
I love cows, actually, but
okay. So bisphosphonates. So this is a great question. So the bisphosphonates with people kind of like a reference point that most of us have is like Fosfomax, which women take for osteoporosis, right? Isn't that what it's called?
Yeah, no, I'm sorry. I was laughing at Angel's comment that she couldn't spell either. Because I read it wrong.
No, I thought you were, I'm still thinking about you in the cow question.
Bring them on.
Bring them on. Caitlin's very popular with the cow
Nation.
So Fosfomax is an oral medication that women sometimes take for osteoporosis. This is in the same category of drugs. An earlier medication of bisphosphonates, and so the idea of these is that they can strengthen the bone, was pamidronate. And that one was a 2-hour infusion, and there was a lot of studies, a lot of them came out of the University of Illinois, and it was kind of meh in how much it improved lameness. So usually they were giving it to dogs that their leg was staying on as a pain medication. It was a once a month pain medication, or they would do it in conjunction with that palliative radiation that I talked to Anne, the Golden's owner, about. Mm-hmm. And the cool thing about what they did in Illinois is they walked them over a plate that measured how much pressure, how much weight they were putting. So it wasn't just me looking at the dog saying like, I think he's better. They actually did what's called force plate analysis. So they got really good objective measurements. And pamidronate was like only 30% of the dogs improved their lameness. So it wasn't that good. Zoledronates had much higher improvements in dogs' lameness. It's a newer generation bisphosphonate. They use it in people when they have cancers that have spread to bone. So it's for bone pain. So like women often have breast cancer that spreads to like bones, like vertebral bones, like spinal bones. So they'll use that. So we use it in dogs as well. Again, a lot of the original studies came out of Illinois. They would give it to dogs that weren't getting amputated in conjunction with radiation. I'll often use it for dogs that they have like osteosarcoma of their facial bones, like their jaw bones, because you can imagine when they try to eat, that hurts, or of their leg bones. The nice thing about it, it's more effective. It used to be really expensive. It's now generic, which is really nice. It's called Zoledronate. I see it up there.
Yeah, Anne found a study, actually. It looks like a clinical trial at Auburn. So the owner we were talking about earlier.
Yeah. So, and Zoledronate's been around. So, the trade name was Zometa, and then it was really expensive. It used to cost me like $800 to treat a big dog, and it's a single-use vial. So that means the vial is only good for one day. You can't use it to, half the vial on another dog the next day. But now, I'm in an expensive part of the country. With the catheter, it's probably $200. Like it's not, and it lasts for a month. Like that's really not that bad. Think about how much, Rimadyl or Metacam costs for a large dog for a month. And we often use it with those, and it's pretty safe. The reason they're using it with dogs with metastasis is so in these studies at Illinois, the dogs that were using it for bone pain with radiation, no chemo, there was a subset of dogs that were living 10 months. So people are like, maybe there's some anti-cancer properties with it. And so I'll often use it in conjunction in some of my patients as well. And so it's very exciting that Auburn's doing a study in dogs with that. So probably in conjunction with other stuff as well, it would require her leg to be amputated. So I would, and going back to this, I would go back, I wouldn't amputate before you go and talk to them, because you have a pretty complicated case that, your pup already has spread. And I would sit down with them and go through all the different options. And you might not do amputation, but you might do palliative radiation with the zolidronate. It's not that, and that might be, and maybe with some chemo as well, and that might be a good option. But was it Angel who originally asked the question about zolidronate?
Yes.
Yeah. So,
which was your favorite of the bisphosphonates?
So zolidronate is definitely my favorite. It's also the trade name is Zometa, but it's now generic. It's given, like I said, once every 4 weeks over 15 minutes. So it doesn't require your pet to be there. You can give it the same day they're getting chemotherapy if it lines up with their chemotherapy. So I had a cute greyhound named Bella that I was treating over the winter, and her owners decided not to do amputation. So we did palliative radiation with injectable chemotherapy. She didn't have spread yet, so she was getting carboplatin, which is the chemotherapy drug of choice, with Zometa once a month. And she went from pretty lame to, over the next 2 months, trotting. I have a set of videos in my osteosarcoma lecture that are just remarkable. Like mom was just happy when she was walking to the mailbox, and then the next one she's like, so, was it the radiation? She was still on some pain meds. Was it the zolidronate? Was it the chemo? Was it that combination? So zolidronate is definitely my favorite, and that is spelled correctly in Anne's post that we have up here. So
she wins, but Angel Stillman's are asking a good question. So.
Yeah, great question.
Great. Okay. Well, there's a couple others. We're at about 40 minutes. So I'm not sure how much.
We can do a few more. I told my kids I would get them in bed tonight.
Are they playing Fortnite?
No, we don't let them play Fortnite anymore because it sucks up my bandwidth. They're no longer allowed to play Fortnite on Q&A nights. That's the rule. They get to watch TV.
So, maybe kind of a general, there was a couple questions, one that came through in the group and one here. So I'll kind of tie them together, which is more about diet. Maybe like a ketogenic diet. Can you speak to that relationship or thoughts on that? I can give you more specifics if you want.
No. It's like it's just,
it's a tricky one. That's why I was like, I don't know if we want to go down this.
The idea with, a lot of the interest in the, I always call it the Atkins-like diet for dogs is the science behind cancer cells is that they are obligate sugar. Their source of energy is sugar, right? So if you go onto I always call it the Atkins diet, right? So a low sugar, high protein, high fat diet, that's where a lot of these diets came from. There was a Hills diet years ago that looked like that. And a lot of the home cooked cancer diets are around that. And now there's a lot of these ketogenic diets as well. I don't have a strong opinion about the ketogenic diets. I think they're, I think what's more important, I think if you can home cook for your diet, if you can home cook for your dog, I think that's going to be better. A nutritionist will tell you that all the time, but I just think that is a lot to do when your dog is going through cancer treatment and you're trying to get them to a facility and you're trying to figure out all these logistics. So I never sit in the room and say, and you need to home cook for your dog.
Right.
But if you want to home cook, but the reason that they're better is just, the source of nutrients, and they can be well balanced and you can get the right fatty acids involved in them. And, it's just the same reason it's better for you and I to home cooked foods than to eat processed foods.
But Chipotle is wonderful. And it's so convenient.
Exactly. But but that's not even, I'm talking about like processed foods, right? So, but I think, to eat whole real foods is always going to be better than some sort of processed foods, and even, than the prescription diets and things like that. So I just don't know that it makes a huge difference. But I do think the science behind a high protein, high fat, low carbs diet, but, as you can see, and this, like grain-free diets are not the answer. And now we're seeing some nutritional issues and things like that.
Don't do that.
Right. And there's a lot of, and I went to a talk with a great holistic person, and he's like, there's a lot of good stuff in some of the grains. You just don't want GMO grains, right? You don't want, genetically modified corn syrup in your dog's food. So again, it's often looking at those ingredients. So that's sort of where I stand with that.
I think in general, that's kind of goes back to the key point, which is for all of these cases and all of these topics, which is it really not only depends on just the cancer, but it depends on the specific dog and what else that dog has to deal with, and getting a nutritionist involved. So like I'll recommend if people want to talk to a nutritionist, obviously we can book them an appointment or get them an appointment, refer them over to the university or one of the specialists, or even there's some online sources now where you can work with a nutritionist to like balance out the macronutrients for your exact dog and their exact weight, and they take into account like their blood work results and all this other stuff. So
and especially for dogs that have other concurrent medical issues, right? Like if they have kidney disease or heart disease, so like I have some patients that have heart disease, and so they need a nutritionist. And then there's balanceit.com is a great website where, if your dog doesn't need like really a hands-on nutritionist, when you just need a little help, that one's going to help. So that's a good one. But, they're getting a nutritionist. Sometimes you don't even have to go to the nutritionist. You can do a phone consult with a nutritionist. Yeah. And so, because again, it may be overwhelming once your pet has cancer. There was a good question. Did you see the one from Tripods?
Yes, let's talk about that.
And so I do want to give a shout out to Tripods in general.
Yeah, they're wonderful.
Because they're awesome. And, I bring them up almost all the time when I'm in the room and, in all our posts and in the amputation vlog that we did. So for those of you who don't know, Tripods is a great community that I the other day I said is a great community of three-legged dogs, but it's for pet owners of three-legged pets. And they're, actually they just posted a video of a kitty cat that just had an amputation. So there are cat owners in there as well. And it's a great community. And a lot of the my clients either are already in the community or will go to that community. And they're just a really good resource. So if you are in this Q&A, you should definitely check out Tripods. It's great. They have great resources, and I just love everything they do. So thank you, Tripods. You guys rock. Yes. And I really, really appreciate. And then one of their hashtag is Tripods rock. So Caitlin, maybe you can throw a link to their website in there. Yeah. So it said a member posted that their family vet diagnosed osteosarcoma in a tissue that he removed, but is it ever not present in bone? And that's a great question. And so, yes, we call that extraskeletal, which means outside of the skeletal system, osteosarcoma. The most common place that we actually see that is the breast tissue, so of the mammary tissue. But you can see it I treated it in the spleen. You can see it in the skin. You can see it in some really random locations. So sometimes you will see osteosarcoma in the soft tissues. And again, the breast cancer is the most common place that we'll see it. So it's a weird one. Often the non-bone ones, there's less information. So again, those would be ones to see a bone cancer specialist. A cancer specialist. One of my favorite patients was this cute little dog, Daisy May. I treated her years ago her mom was going through breast cancer treatment at the same time. So, and it was in the spleen, and I kind of looked it up, and the books told me, and the papers I could find, 1 to 6 months, and we treated her. She got her spleen removed. I treated her with carbo, which is the chemo of choice. She rocked it. She had no side effects. She did really, really well. I treated her with metronomic chemo afterwards, and she lived like 5 years.
Awesome.
Yeah. So sometimes I tell people for these atypical locations where we don't have a lot of information, sometimes they do really, really well, and sometimes they do poorly. I think we don't have enough information. And so often I think they're worth treating and just seeing how they do. But, you know, when there's not a lot of information, I hate to condemn pets on sparse information. So Daisy May was really a statistics buster.
Agreed. Yeah, they followed up that their example that they
This one, right?
Yeah, it was in the tissue of the limb. I'm not sure about that.
Yeah. I mean, you could have it in the skin, but yeah, I would have to kind of probably review that case in person. Yeah. So that would be one, you know, for tripods, you know, if you're communicating with that pet owner, that would be one that I would say they need to go see a cancer specialist, vetspecialist.com or vetcancersociety.org, because, you know, guys, when you're seeing a weird case, you know, those are cases where I often reach out to my colleagues and I get second opinions on the biopsy. Like, these are often weird ones. And, you know, I still see cases where I'm like, that's unusual. So, you know, cancer can be challenging. There are some cases that are really straightforward. I still think a cancer specialist helps, but there are some cases where, and I think it's okay. I think it's a good sign when you have a doctor who's asking for help for other doctors. I don't think it means that they don't know what they're doing. I think that means that they're trying to get you and your pet the best information.
Yeah, I would agree. Everybody who does that.
I love you, tripods. I should have known that you guys did that. You guys are the best. You know what you're doing. Anything else?
Yeah, I think that's about it.
Let me bring you back on nice and big.
I don't know about that.
Let me make sure there's nothing on my agenda that I forgot. So just a reminder. So on my website, ton of resources, information. So our skin maps, if you are tracking lumps and bumps for your dog. What else do we have there?
We've got information, a couple handouts, like what to do when your pet is going through chemo.
Yep. And then, you know, and a lot of those handouts I've recently made into videos as well. So really just to go back to YouTube, you know, what I have found is that a lot of people prefer videos over reading. So we have our chemotherapy side effect sheet, you know, just what meds that you should have on hand at home. So if you've decided to do chemotherapy for your dog with osteosarcoma, definitely we have a playlist, everything you need to know about cancer. So side effects, home safety at chemotherapy. I just did a new video about that there. So really, again, really trying to put everything in video form as well. The spay neuter one is there. So I think all of that's there. For the calipers, we always like to just give a little, if anybody is interested in the calipers to measure lumps and bumps. I know there's a few veterinarians out here. We got our plastic ones. I gave out so many pens at Florida Veterinary Medical Association. It was awesome. And then we have our digital calipers as well. So that's the code for that. So 15% off.
What's the code again, Dr. Sue?
What's that?
What's the code?
Dr. Sue 2019.
Okay.
And that's it. This will end up on YouTube in a couple of days or so when somebody does their magic. I don't know how it gets there, but it does. The osteosarcoma part 1 will be out at the end of the week. Part 2 with treatment, including palliative options, which will go over some of the things that we highlighted will be there. Caitlin will tell me what I'm doing next month. She will tell me when I will be here next month.
I will be texting you about that later. We can pick a date. But
tomorrow. How about tomorrow?
Skin maps. No, skin maps. Skin masses, I think.
You're awesome.
We'll talk about skin maps again next month too. I mean, they're great. So
thank you so much, guys, for joining us. We appreciate it. Caitlin, thank you for doing this at the end of your workday.
Happy to do so, of course.
So much better when you're here.
I'm good at the links. That's what
You're
I'm
good
here
at the links.
for.
You're good at the links. All right, everyone. Have a good night. Thank you so much. Kick cancer's butt, and we'll see you all soon. Bye.